Good morning/afternoon, everyone. I'm Joshua Benitez-Castellanos, and I'll be speaking to you today about multiple sclerosis and a possible new treatment. So we'll start off with what is multiple sclerosis? Multiple sclerosis, or MS, is a demyelinating disease that causes the myelin sheaths of nerve cells in the spinal cord and brain to degrade. Physical symptoms include loss of sight or double vision. The loss of sight generally being specified to one eye rather than both, or a diminished amount of visibility. The double vision being attributed to the degradation of the nerve cells. Loss or change of sensation. Change being an excited or elevated state of sensation, or loss being in the extremities. Unstable mood changes and depression. So by unstable mood, we actually mean instability, irrationality, and all sorts of changes due to chemical imbalances. And muscle problems, ataxia, weakness, and pronounced reflexes. So with ataxia, we're actually speaking of the muscles having random intermittent spasms or reflexes that are highly pronounced, highly reactive. So, the physiology of multiple sclerosis. Multiple sclerosis targets the coating of myelin in nerve cells called axons, this being the axon here, having several components there. The myelin sheath acts to increase the speed of conduction, which is the impulses being transferred from one end of the nerve to the other, which are electrical messages sent throughout the body. This means that the myelin sheath decoding here actually degrades due to this disease, and the impulse sent from one end to the other is decreased. The following results include the physical symptoms from above. So MS breaks down the coding, therefore impeding the messages reaching their destination, thus causing the muscle weaknesses, muscle spasms, and neurological symptoms observed in sight. A cause for MS has not been confirmed. However, the current held explanation includes a variety of factors. MS factors such as genetics, viral agents, and environmental. Genetics, there is a specific type of chromosome that is present, an alteration rather, present in multiple, in fact most MS patients. Furthermore, viral agents seem to be a clear part of the disease because there are things called oligoclonal bands which are present. Oligoclonal bands are immunoglobulins which provide evidence that there should be a viral agent present. And finally, environmental. There seems to be a pattern that the further away from the equator, the more likely you are to contract MS in the MS patients as of now. The theory is being, however, challenged as of 2002, there is a decrease in this pattern. So, detection methods. How do we actually detect MS? Methods of detection include the presence of the oligoclonal bands in the cerebrospinal fluid. So, the immunoglobulins, oligoclonal bands, actually are present in most, if not all, MS patients, hence why we speak of the viral agents. Inflammation due to spikes in the permeability of blood-brain barrier causing an immune response towards myelin in nerve cells. What this means is, this is evidence for an autoimmune disease. The myelin sheath in the actual nerve cells, they start breaking down, and because there is that breakdown, T cells in immune response cause inflammation, which therefore leads to more immunoattack, decaying the myelin sheath itself. The final detection method is lesions or scars. So hence why it's called sclerosis, meaning the scars in the brain, which can be detected using MRIs. If you look over here, this white spot here is actually a lesion in the brain, specifically in the white matter of the brain. So what are the current treatments at the moment? The current treatments as it stands is more of a remedy rather than a treatment of the disease. Therapies are used to decrease the frequency and quantity of symptomatic attacks. However, there are chemical therapies which seem to minimize or prolong the onset of MS symptoms, including interferon beta-1b and glatiramer acetate. Now, for the actual research conducted in this article, Dr. Harold Atkins and co. from the Hospital of Ottawa, Canada, wanted to see the effects of stem cell therapy combined with chemotherapy on reducing relapses in 24 severe MS patients. The difference in their approach was that instead of suppressing the immune system, they destroyed it with a stronger chemotherapy regime. Now, as for the findings, the research findings actually demonstrated that 23 out of the 24 patients exhibited no relapse between 4 and 13 years later, and only 1 out of the 327 MRI scans showed any new lesions forming. Furthermore, 8 patients showed continual improvement of scores on the EDSS disability scale up to 7.5 years after treatment. However, 1 out of 24 patients did not survive treatment due to liver failure and sepsis, and a further 22 patients experienced mild to moderate toxic effects. From that, we deduce that there is still some harmful risk associated with this treatment. Hence why when we go to limitations, we look at the actual sample group and what it actually means as a treatment pattern. So some of the limitations of this research was that there were only 24 participants, or patients rather, in this sample, which means that it's hard to generalize that kind of treatment for all MS patients. Furthermore, more trials are needed to actually confirm the results that were found in this research. Finally, it has been recognized that it is an aggressive treatment, but several neurological researchers say that if confirmed as a plausible research in specific patients, it could one day become a general treatment. So that is the future implication we actually see out of this finding of over 13 years of research, that one day this could potentially be a generalized treatment for most MS patients. Thank you for listening. If there's any questions, please let me know afterwards.